I saw the breast specialist, he looked at my report, and I saw him hitting his leg, down, knowing he knew that there was a problem. Daktari, are you joking or you're serious? He said, no, I'm serious. I'm not here to joke. And then we went silent.
Oh.
You know how you're just showering, then you feel, oh, something is abnormal. I'm one of those that has not been very regular in doing just body exams. Yeah. The easiest way, the new doctor in town is Dr. Google, who can kill you before.
Hi, this is Health Focus, and my name is Emmy. The Bible says that as for me, I look to the Lord for help, and I wait confidently for God to save me, and my God will certainly hear me. Welcome back again to the story of this week. Thank you for the engagement we got last week when we were talking and we were featuring a story of breast cancer. When you look at the statistics of breast cancer in the country or in the world, it's such a leading cause of death. It's a disease that can be managed whether in 4th stage or in this 1st stage. Some people are saying on the LinkedIn and on the TikTok page that when you've been diagnosed with stage 4 or stage 3, it's a condition that you have to give up. And there is nothing that can be done by the oncologist. I agree. There is nothing that man can do. This thing can only be handled by God. Our guest today is a woman of God I've known for so many years. The first time I heard that the diagnosis has been done, we were meant to do ministry. We were going for ministry, and there was such a cloud, we couldn't understand what the issue was. But finally we learned it was that disease that makes people sink down. But again, there has been an uplifting. Welcome to the show, this woman of God. And let's get on. Welcome, Florence.
Thank you, Emmy.
Thank you so much. Kindly introduce yourself to the viewers.
My name is Florence, Dr. Florence Ambayo. I am a clinical psychologist. That is the work that I do.
Yes.
Or that is my training. I am a mother of 2 grown boys and 1 little girl whom I've named after myself. She's 5 years old.
Wow.
I am a grandmother of 2. One is 2.5 years and another one is 6 months. I am a wife, and I am a gospel singer.
Yes.
I love to worship God.
Yes.
They call me Mama Hymns. I love hymns. I am the, can I call it founder?
Yes,
Founder
you are the founder.
The now very popular hymn nights.
Yes.
And we are having many people singing hymns. My desire has been to just see the 3rd and 4th generation Pentecostals and other mainstream churches, the 4th Pentecostal generation, the 4th generation of Anglicans, the 4th generation or the 5th generation of PCA, to just see them sing hymns again.
Hymns. And what people don't know is like if we were ranking in the world vocalists, I think she'll be top 1. If we have several ones, she'll be among the top ones. Find her on YouTube, Florence Ambayo. Yes.
Thank you. Yeah. So, well, generally that is me. That is me. I don't know what more I can say.
I don't know.
I am a breast cancer survivor.
Mm-hmm.
Yeah, that is one other disruption that I had in my life, as I was going on with my normal life, you know. And so that I don't make it like a common addition to my introductions every other time, but it's a big disruption.
Yeah, please
It's a
do.
big disruption. And because of what we are talking about today, I think that fits in the introduction.
Absolutely.
Yeah.
She's a cancer survivor of breast cancer stage 3.
Yeah.
And she's gone through the treatment, she's gone through the highs and the lows. But before we continue, please subscribe to Health Focus, please share, please like, also jump to Florence Ambayo's YouTube page, like, share, sing with her. And when there is a hymn night, which we are planning to have for Easter,
Yeah.
well, when is the date and where? We are
The weekend before Easter is 11th. I think it is 11th of April.
Yes.
11th of April. That's a Friday evening. Yes. We are going to have a hymn night, an Easter hymn night. It's called the Blood, the Cross, and the Victory.
And who is welcome?
Everyone is welcome. Any hymn lover is welcome.
For the hymn night, I will be there. She will be there.
Oh yes, I'll be there.
Why won't you be there?
Sure.
Okay, let's dive into the story.
Yeah.
The first time you were diagnosed. Take us back to that time.
This was, I think it must have been February. Sometimes it is not very easy to remember some dates.
Yes.
Certain things you want to forget them very quickly. But that was February 2023. Yeah, February 2023. I just felt a lump, but it was closer to my chest bone, really, upper, up on my chest bone than on the breasts. Yeah, just something hard that was growing. And I thought, simple. It's just a boil, normal boil. I'm gonna push it out, waiting for it to toa macho. You know how we say.
Did it come accidentally, or you were intentionally doing an exam?
Oh, it was just accidentally. Oh. You know how you're just showering, then you feel, something is abnormal. I'm one of those that has not been very regular in doing just body exams. Yeah, and it just happened that we were visiting a friend that was going through breast cancer treatment.
Oh.
And after we visited her, she told us, ladies, all information about cancer. The only things that we don't do is we don't examine ourselves. Oh, yeah. So she told us, go home today and examine yourself. And that is how I examined myself and found something growing on my breast. And then went to the doctor. You know how you go, you Google a little bit. I went to the doctor. The doctor, the general practitioner, looked at it and said, this is dimpling. That's the word he said. I can see a dimple, You may need to do a biopsy. So please just go and look for, a mammo. He said a mammo, so he wrote for me. And I stayed with it for like 2 weeks.
Without doing a mammogram?
Without doing a mammogram. I was taking it lightly and thinking, it will go, waiting for it to go.
Was it painful?
It wasn't painful. It was just a hard mass, It wasn't painful. As usual, I'm a believer. I think I should have said that. I'm a born-again Christian. I prayed about it. Prayed and said, Father, this one should not be anything terrible.
And you believed.
And I believed. And then I sat in my drawer with that, with the doctor's prescription.
Yes.
But as I was talking to a friend and asked her to pray with me, she told me it's not just about prayer. Wake up and do something. What is the doctor telling you to do? I said, I have the prescription in my handbag. And she said, please go, get it done.
That's 2 weeks later.
Yeah, 2 weeks later. The lady struggled to really get the mammo because of where it was, where the lump was. Eventually got it. gave me the pictures, gave me the report. I threw the report in Google, Dr. Google, and got so many things about the possibilities of what it could be. And that scared me because of what the report was reading and what Dr. Google was saying, highlighting possibility of malignancy. Possibility of malignancy, you know, everywhere, based on what the mammogram was saying.
Why weren't you asking the doctor instead of going to Google?
Because I think it is the easiest way. The easiest way. The new doctor in town is Dr. Google, who can kill you before you die.
Thank you for saying it, because men have died before the right time.
Yes.
Uh-huh.
Then I just picked it up and, you know, I didn't know where to take it. So I decided the only person I know is my gynecologist. So I went to this very nice gynecologist. He sat with me, read the report, looked at it and said, I'm not a specialist in this, but I know someone. And I think you need to see this person immediately. The moment he said immediately, then I knew something is not okay.
It's not right.
So he said, you need to see a breast specialist immediately. And so from Hurlingham to Nairobi Hospital, and I go to the breast specialist, and he's waiting because he called him. He said, I'm sending a patient, please wait in the clinic. And I just walked to Nairobi Hospital, to Nelson Awori Center. I saw the breast specialist. He looked at my report, and I saw him hitting his leg, you know, down, knowing he knew that there was a problem. But he said, before we confirm anything, we need to do a biopsy. And so he sent me, he called again, another doctor at Nairobi Hospital next door, and said, if you're leaving now, I'm sending a patient right away. Please don't leave. And within, I think it was within a span of 2 hours, I was between 3 doctors.
Wow.
And sort of in a shock. Why is it happening so fast? And anyway, the biopsy was done, and the waiting was what was challenging.
Waiting
because
for
I
the
needed
results.
to wait. Yes, I needed to wait
Yes.
for
72 hours?
not 72 hours. They told me to get the results after 7 days, because it was the core needle biopsy. It was not the other biopsy.
It's not the fine.
Yeah, it was the fine needle biopsy.
What
Core
is
needle.
going on in your mind? All this.
Now is when I was on Google reading everything. I became a researcher. Researcher without results. Just reading. What does malignancy mean? You know, what are the treatment modes? What happens if there is malignancy? You know, and I was getting more and more anxious as I was reading all this, waiting for the 7 days. They were quite anxious moments of waiting, but eventually the results came, and the doctor called and said the results are here. So as I was going to pick the results, a friend called me and said, I prayed for you with you the other day. Have you gotten your results yet? I said, I'm going now. Who are you going with? I said, I'm just going alone. She said, no. Stay where you are until I come.
God sends help all the time.
That is it. And I stayed where I was until she came. Okay. And she said, let's go together. At least let me sit there and hear. Whatever you will not hear. It's always nice. You know, she said, it's always nice to go for results with someone. And that is what I really want to tell people right now.
Yes.
As you're listening to me.
Yes.
It is a good thing to go with somebody to get your results.
Always.
Yeah.
Because I told them, if they can go back to my video, when I went to pick the results of my mother's breast cancer, I was alone. I am a health professional. But at that moment I died. I opened the results, I read, I can understand everything. Yeah. It is always good to have somebody holding your hand. Because
what happened next when we got into the doctor's clinic was not nice.
Okay.
Yeah, because all the doctor did, I think he has seen a lot of these cases.
That's true.
Yeah, so all he did was looked at the results and then looked at me and said, sorry, you have cancer. And then both of us with my friend, we went, what? Are you serious?
Just like, pa.
In fact, we said, Daktari, are you joking or you're serious? He said, no, I'm serious. I'm serious. I'm not here to joke. And then we went silent. And that is when my brain stopped. And now my friend listened for me. I'm glad she came.
You stopped listening.
I stopped listening to what the doctor was talking. My brain went off. It froze. I had a brain freeze. And for the next hour, because the doctor really talked, I cannot remember what he said.
We didn't hear.
But he was drawing. He was giving the pathways for treatment. He was saying we shall start here. He's an excellent doctor, by the way. I would recommend him to anyone. Excellent, patient. He will explain everything. Step 1, this is what we are going to do now. Now that we have these first results.
Yes.
And then from here, you will go here. If this comes out from this second test, then we will go this direction or we go this direction. He explained it so well with drawings and everything. He even drew the breast and how it looks. I mean, he did everything, but I wasn't hearing anything.
At that time, did he tell you the stage? Did he tell you?
Not really, because I think that time you really quite don't know. With the first results, you really don't know the staging and other. And he wasn't too bothered about the stage. His main concern is that you get treatment. And I realized that actually the staging is not a big thing. No, it's not a big thing. The thing is how you respond to the treatment, and if you follow the treatment, you go on. I mean, life goes on.
Absolutely.
Yeah, life goes on.
How do you get out of this office?
Oh yeah, when he finished, he sent us now to the lab again. He said they will use the same results to get what they call the histoimmunochemistry.
Yes.
Yeah.
Yes.
To get to know which type of cancer it is, because there are different types of breast cancer. And so again, that took 14 days. And so within those 14 days, I actually asked whether I could travel and do my work, because I was traveling. I was going to Côte d'Ivoire to do some work. And he said, yeah, you can go. There is no problem. But after 2 weeks, when we get those results, we must get to treatment immediately. I said, that's fine. And so I traveled, which was quite a relief. But I realized that my hand was always praying. You always saying, Father, let this thing go. Father, by the time I get the results,
and it's not going.
And it is not going. It is still there. Really? But while I was out on the trip, he actually called me.
Yes.
And he said, I am afraid that your results are out. They are out earlier than we had planned. And what I feared is the kind of cancer that you have. It's a lot more aggressive, and you have to start your treatment right away. So make a decision, talk to your family, come back to my clinic, let's give you the treatment plan, and then talk to your family and begin. And that is, well...
That's how you left Côte d'Ivoire.
Well, I left Côte d'Ivoire with those results, but there is something about knowing God. That is what I would say. There is so much about knowing God.
Yes.
I wasn't panicking.
Peace.
Not at all. Not at all. I wasn't panicking because I know that God is still in the business of healing. Yeah. And if God allows me to go through this, He's gonna walk with me. He will not leave me.
He won't.
He will walk with me, and it will be for His glory. It is not a pleasant thing. It's not a joy for Him to see His children down, and struggling, and in so much pain. That is not His joy. Yeah. So He was going to walk with me, whichever way it was gonna go. And so for me, actually, I was so much at peace. I did my work. I finished my work. I came back home and talked with family, let them know what the issue is. Of course, I talked to my pastors. They prayed.
Oh, we prayed.
Oh, prayer was said.
Prayer was raised.
Prayer was raised.
When you want to sleep, you remember.
Yes.
You start praying.
Prayer was raised.
Yes.
And I'm grateful to God for those prayers.
Yes.
Because that is the reason I am here today.
So how did you get into treatment, and how did you get into that decision for treatment, and how was the process of treatment?
First, I was call it in a bit of denial, because I read what conventional treatment is like, and it is harsh. It is harsh. The chemotherapies, they are very harsh, because that's what the doctor knows. That's what he recommended. So I read a little bit, and I listened. I talked to a few people who have gotten through treatment the natural way. The natural way is either
Alternative
medicine. And there is so much out there. You get confused. And I thought the alternative way looks better.
Yes.
Yes, because you won't go through the harsh treatment, everything.
Yes.
You'll just be taking your mitishamba, pole pole, pole pole.
Concussions.
Yes, concussions. You remove this food, you remove this one, add this one, do this, do your exercises, pray. Because God is really in the business of healing. And all these things were created by God. But our friend, when she heard about it, she said, I would like to see you. She actually sent herself to me. When she heard about it, she said, allow me to talk to you. And I said, I'm fine. I'm listening to everybody. So she came and she looked at me straight in the eye and said, Florence, I don't know what is going on right now, but I want to tell you this one thing. Do what your doctor tells you. Because I've been through it. Do what your doctor tells you. Then the others, add them. Supplement. But do what your doctor tells you.
Yes.
And she said, we have lost many people because they refuse to listen to the doctor. I said, nobody has told me that. And it doesn't cost anything to listen to the doctor.
Yes.
I don't lose anything by listening to the doctor. So I listened to what the doctors told me, because there's science, then there's faith. And God is the one who has given doctors knowledge.
Yes, it's true.
And so I believe the doctors are not doing something wrong. Yeah. And so I got into treatment. We eventually got into treatment, and I did in May, 16th of May, 2023. A day I'll never forget, because it is my birthday.
Oh, okay.
After many, many rigorous tests, and my body was poked, my blood was drawn. I'm telling you, I walked into places I have never walked as far as hospitals are concerned, because I've been generally a healthy person. Generally.
Yes.
I have not been in and out of hospital, actually. I've been quite healthy. So this was really the first time.
You're coming into the hands of
health professionals. And what they are telling me is not very nice, because they are, of course, they counsel you. I needed a counselor. I'm a therapist myself.
Yes.
But after being told, even, they showed me, actually they were very nice. They showed me, they were telling me, I was asking, what exactly is this chemotherapy? It is actually chemical therapy.
Yes, it is.
Chemical
It
therapy.
is chemicals.
So I was asking, which chemicals are these you're mixing? And I remember one pharmacist telling me, oh, we even have to wear PPE.
Yes.
The PPE.
Yes.
We have to wear our gloves. We have to wear, because they are dangerous chemicals.
Yes.
That is what he told me.
They didn't lie.
Then I said, these chemicals are going to be put in my body? And he said, yes, because we are only looking for that cancer cell. That is what we want to kill. We will not kill you, but we will kill the cancer cell. That's what we are looking for. And that is the reason why we have to do this. And they would prepare, they would carry them, covered. The person bringing from the lab where they have mixed them is all, covered nicely. Quickly, it is put in some sort of freezer, some cool temperature. And the first one, which was done for me, well, before, I said, give me time. When they now said, ready, we are beginning on 16th.
So you are going to do this chemo
Yeah,
before surgery, right?
before surgery. That was the treatment plan. Chemo,
Then surgery.
reduce the lump, then surgery.
Now,
After
because I know, okay, this is the disadvantage of having information private to knowing. Because I know this chemo was not done in country.
Yeah.
How was the decision of deciding to be treated out country than in country? How did you land there?
Well, it was not actually a decision. My husband was actually going for treatment to India, and I was going to be the caregiver. He had his own challenges. So then we were two patients.
One is caring for the other.
One is caring for the other. We said, let's just care for one another. So because his time was actually there, ready for him to go, we were supposed to go to India in April. And we had been trying to raise funds to look for money and other. So when his time came to go to India, I was going to be his caregiver.
And you are sick.
Then now, my diagnosis came. So I asked the doctor, is it okay? Because I'm going as a caregiver, can I go and start my treatment there?
Okay.
And then come and continue and finish the treatment? And he said it's
fine.
Totally okay. So that is how I actually...
You began chemo out.
I began chemo out there. But I did not finish it there. I was doing it here in...
You didn't fear getting complicated as a caregiver, as a chemo patient?
We didn't know. We actually at that time, now I know better. Don't go to patients and think you're caring for one another. It didn't work.
That's I'm scared. You're going for chemo, this is going for his treatment. He's going to give you coffee.
Both of us were sick. Patients trying to help each other because we didn't know the effect, what the effect of this chemo was. But anyway, the first thing I did was actually I asked for a therapist. And I got a very good psycho-oncologist. And she explained to me what this chemical therapy is. And she also helped me. Before I made that decision to sign those papers, I had to go through therapy. And I am glad I did. Because I was afraid. What was this thing going to do? I looked on the internet and saw what chemotherapy does. You know, I read. I am a researcher.
Yes.
I am a psychologist. So I read. I was
and
not
information
taking,
is there.
Yeah, information is there. So it was on my table. I was reading and reading. And I think the more I read, the more
I got scared.
Yes, I said, hey, this thing.
What are you scared of, majorly?
I was scared of the reaction of the chemo. Some people have reacted very, very badly. Because I've seen even some friends, you see their bodies are burnt, literally, burnt. I was a bit reserved about that one. But anyway, I started the treatment.
Yes.
I started the treatment, and they told me what it was. They gave me all the counseling. They told me what will happen. I had my nice long hair. They said your hair is gonna go off, but it will grow again. They quickly said that. I wish somebody told me a little more about that one. And then they told me what it will. They said you will have a running tummy. It's a bit harsh. What we are giving you is harsh because the kind of cancer you have is aggressive. And I didn't understand until they actually started the treatment. So the treatment was okay. They treat you well. They make sure that they're checking your pressure. They're checking as you're getting, to see how your body is reacting. So the doctor is there. Actually, for the first 4 hours or so, the doctor was actually there. And the nurse, checking. They go, another doctor comes to just check how are you reacting, how are you responding. And they see you are responding well. They discharge you. You go home. And they wait for the aftermath. And the aftermath came, I think, just about, maybe I went home. It's like 24 hours later.
The body starts.
That's when the body really started reacting. My tummy was running. I was throwing up. My body was dry, literally, and then 2 or so days later, my hair just started falling.
Oh.
That's when I I was pulling it off with my hands, you know, the way we pull feathers from a chicken.
Oh.
And that was it. I had been prepared.
At least.
So it wasn't like so shocking.
Mm.
Yeah. So, and they told me, you know, they just keep checking how you're doing. They say this is normal, this is normal. They give you medicine to help you with the nausea, with everything, to make you as comfortable as possible. That's what they really did.
Yes.
And they really tried. I can just really commend what the doctors are doing. They're doing a great job. They know just the fear that comes with a cancer diagnosis.
Yes.
So they try to make you as comfortable as possible. You can see many case studies of people that have come through it.
Yes.
And I had enough people to talk to me. I'm telling you, I had enough
You
people
had a
talking to
lot
me.
of information
I
that
had a
was
lot of
required.
information. People are telling me it's okay, you're gonna make it. You know, this will happen, but do not worry, it's a season. And so I was very encouraged.
Did you fear that you will be unable to come up in the process?
I wouldn't say I was afraid as such. The only thing, if I take you back to when you hear about a cancer diagnosis, the first thing that goes through your head is death.
Yes, yes,
Yeah.
yes.
Now, reframing that statement is what was a little difficult for me. And that is what is difficult for many cancer patients.
To change.
Your brain begins telling you death is coming. Okay, you're trying to do treatment, but death is coming. This is a death sentence, you know. So the more this rings in your mind, the more you actually go down.
As a man thinketh, so you become.
That is it. And so I really, because of my understanding again as a psychologist, I really had to restructure and reframe these statements for my sanity. But it didn't mean that you're not afraid. You know,
You have those
yes,
seasons.
there are those seasons and moments of fear, concern. What will happen? You know, my hands started getting black. My feet were getting black. My nails were black. You know, my body was not mine. My whole body was black. My hair now has fallen off, so I have this kipara. My face and my head looked the same. And the doctor said, come for checkup after the 4 chemos, which was now about 4 months, because it's every 3 weeks.
Yes.
And so when I went for checkup, because they put something.
The marker,
Yeah, they put the marker. When I went for checkup, they couldn't see any lump at all.
Oh.
They couldn't see any cancer cell in my body at all.